Well, hello, everybody. Thank you again for joining us for our weekly call related to COVID. So with this, I've got a little presentation here that we're going to go forward with numbers and some other information for the last week. So with that, it's all yours, Siobhan.
Okay, we actually have a short little agenda for today. So we have a couple of topics that we're going to talk about. And the first one that we're going to discuss is actually our gold standard is a 14-day quarantine, which we're going to turn over to Jessie.
Hi, I'm Jessie Phelan, Nursing Manager for Sauk County Public Health, and you may have seen the press release that we sent out earlier this week in conjunction with area schools and our area healthcare providers, discussing some new two alternative quarantine strategies that the CDC has put out. You can find more information on that in the full press release on our website. We just wanted to touch on a couple of things that we and DHS, our schools, and our healthcare providers still recognize 14-day quarantine for someone exposed to coronavirus as the gold standard. So there are a couple of scenarios, or rather settings, where you would want to definitely make sure that that is followed, and those would be your congregate settings. So, and the reason for this is we have seen some cases outside of that, 10 days turn positive on days 10 through 14. So we just want to be extra careful in those settings. So again, bottom line, 14-day quarantine is the gold standard. And I think the next item is mine as well. Just a reminder for those who should get tested, anybody with any COVID-related symptoms, anyone who has had close contact with somebody who has tested positive for COVID-19, or anyone who spends a lot of time around other people with regards to their jobs or things like that, with, like, for example, as Siobhan has on the screen, grocery store employees, restaurant workers, things like that. If you find yourself having to have contact with a lot of people on a regular basis, it's a good idea to have regular testing done. And she's got the link up here to our testing site information. If you go to that data dashboard and you look at the COVID testing site locator, if you hover over those spots, it will tell you specific information to each testing site that is operational in Sauk County right now. COVID vaccine update, we are still in the process of learning what COVID vaccination is going to look like for Wisconsin. Today is the day the FDA is going to hear information for the request for emergency use authorization for the COVID vaccines. That is the next step in the process. It needs to happen before vaccine can be distributed to the states. So we will be presenting data on that information as it is relayed to us about that. In the first phase, just so everybody is aware, phase 1A, that will include healthcare workers, long-term care residents, and long-term care employees. And at this point, we know that the numbers that we are probably going to be allocated are not going to be enough to quite cover all those folks. So more information to come, and again, as we learn more, we will share it with you all. Thank you.
Next, we're over to Jeff for other updates.
Just related to our county buildings, just want to remind everyone that the West Square building, Reedsburg Human Services, are still by appointment only. When we do have our public meetings, the doors will be open for committees. The courthouse remains open as normal, and right now that is slated to go through January 10th. So we will keep you update as we continue to get closer to that January 10th date. One other thing, we did have our Maintaining Wellness During Stressful Times with in cooperation with Human Services and our My Strength app. I would highly encourage folks, if you did not see that, to go to the public health website. This is something that we're going to do on a every 3-week basis. So our next one will be December 29th. And we are working right now with Human Services to develop 3 or 4 topics, and we will get those out ahead of time so people can get those on their calendar. That's all I have, Siobhan.
Okay, next we'll move on to questions. So for this section of our weekly COVID update, if you have a COVID question, if you could email that to covid19@saukcountywi.gov, and we can answer your question on an upcoming coronavirus update blog. So for today, the question that we received was, if someone doesn't have internet access or doesn't have a smartphone or computer to access the LifeStrength app, what are some other ways for them to access mental health and wellness resources?
Well, I'll take that one. So what we would ask individuals to do is, and to spread the word here too, to members of the community, if you know folks that might be interested in some of the things that were on that My Strength app, or just need some additional assistance with human service related topics, to call our health or human services department. And that would be at 608-355-4200, 355-4200. And talk to the receptionist up front, and they can identify the resources that are available, or maybe someplace that you can reach out to. Again, if you're having trouble finding something, or you're not getting the information you need related to COVID and stress and those types of things, you can just email us again at that covid19@saukcountywi.gov, and we'll see what information we could find for you. So thank you, Siobhan.
You're welcome. Okay, and then after that, I'll go ahead and we'll start our data update to share with you COVID-19 trends in Sauk County. I'm going to swap screens. So we are over now to the Data Hub, and I'll start by giving an update on today's data. So today is Thursday, December 10th. We have 42 new confirmed cases to report. There are 66 new recovered cases, for a total of 547 currently active cases today in Sauk County. Unfortunately, we do have 2 more deaths to report today, and also 2 new hospitalizations. So that brings our total number of people in Sauk County that have lost their lives to this virus to 21, and our total of people that have ever been hospitalized to 139. So that information is available on the Data Hub. I want to take just a minute here to talk about some of the trends. When we looked at November, the first half of November, we saw a pretty dramatic increase in the number of new cases per day. And then toward the end of the month, that average number of cases per day, that green line, has gone back down. Overall, in the month of November, we averaged 55 new cases per day, and we also averaged 2 people hospitalized per day. Now that number has since decreased, so when we're looking at the beginning of December here, we're now averaging, so in December we've averaged about 45 new cases a day, which is a decrease from that 55 cases a day that we were averaging in the month of November. And we're also seeing a decrease in the number of new hospitalizations. So in the first 10 days of December, we've averaged just over 1 new hospitalization a day. However, when we look at our death data, in the month of November, we averaged about 1 death every 3 days. So total 11 deaths were recorded in the month of November. And so far in December, we've recorded 3 deaths. So we are continuing that trend of 1 death every 3 days. And on the Data Hub here, you can see the deaths over time chart as well to see how that increases. Currently, right now, our doubling time is at 39 days, which is much better than it was here at the peak in November when we were down into the 20s. So I really am liking to see that doubling time going up and our new cases per day going down. So yes, that's great. I really like seeing this decrease in new cases per day. But the question that I'm getting is this because of a decrease in testing? And the answer is maybe. So in November, we were averaging 510 tests per day. So far from December 1st through December 8th, because that's what I have the most complete data for, we're averaging 431 tests per day. So that's a pretty big decrease in our tests per day from what we were testing in November to what we are testing so far in the beginning of December. So when we're looking at, this decrease in new cases per day and the factors that are contributing to this decrease, part of this is why we do track more than one data point. So we don't want to look just at one to kind of give us the full picture. And so the data points that I look at to see, okay, is this decrease in cases really a decrease in new cases, or is it a lack of testing? What I want to look at are two other metrics. And so we'll skip down here on the data hub. And so the first of those two other metrics is our percent positivity. So when we look at our percent positivity, so Sauk County has been for the last little bit in the medium percent positivity rate. But when we compare the past 7 days, so the percent positivity is kind of increased to 9.9% to back in the end of November, where that 7-day average percent positive was 8.9. So if this percent positivity was below 5%, that would indicate that we're doing enough testing and that our testing level is getting all of the positive cases in our community. When this is in that 5 to 10%, it's kind of that medium of this isn't really where we would like it. And if it were above 10%, then that would really indicate that we're not doing enough testing. We're not testing all of the positives in our community. So that's the first kind of, well, maybe our decline in cases is due to not testing enough. The other factor that is kind of giving the maybe our decline in cases is not due to enough testing is our community spread. Now, in Sauk County, our community spread has consistently been over 30%. And in the past 14 days in particular, of the cases that we were able to complete interviews with, 34% of them were not linked to a known source case. So those two additional data points, the percent positivity and the community spread, are part of the puzzle of is our decline in new cases due to a decline in testing, and kind of some of that information that we take into consideration. And so the answer is maybe, it could be. So we really want to encourage everybody that if you have even one symptom, to please go get tested. If you have been exposed to somebody with COVID, please go get tested. If you think you may have been exposed to somebody with COVID, please go get tested. If you're somebody that works in a congregate setting, so if you are a grocery store worker, if you are a restaurant worker, if you are exposed to a large number of people on a daily basis, then we would really recommend that you consider getting regularly tested. Because being tested and knowing, okay, here's where we can identify a positive case, we can isolate that case so that we can then stop them from unknowingly spreading this virus about in our community. That's one tool in our toolbox for us to slow this spread. So please go get tested. Some of the other data that we can update on, if we want to scroll back up here. So we overall look at our metrics. So our case activity, even though our cases are decreasing, we are still in that very high case burden level. So if you do jump back up to the top of the data hub here, sorry for the lots of scrolling. I did add lines to our cases over time chart. So you can see how for much of November, we were above the critically high case burden line. Right now, we are kind of in the upper third section of the very high case burden. So in order for us to get out of the very high case burden and into the high case burden band here, we need to drop below 15 new cases per day. And then for us to leave the high level, we need to drop below 5 new cases per day. So yes, our new cases have been decreasing. This is great. It does show, because I know there are a lot of people that are taking this very seriously and are practicing all of the COVID precautions. It's working. There were a lot of people that listened to the guidance and that celebrated the holidays at home with their immediate family and the people that they live with. Thank you. I do think that that is a factor in some of our decreasing case rates. So please continue all of those practices so that we can continue to get our new cases per day. This green line, I talk a lot about this green line, about how we can get that even further down so that we can continue to stop the spread of this virus. And ultimately, we're preventing people from getting sick. We're preventing the most vulnerable to this virus from being hospitalized. And if we can stop the spread, we can also decrease ultimately the number of people that lose their lives to this virus. So all of those actions matter. And thank you for those of you that are practicing them. Really appreciate it. Okay, on to some of the other data points. So there is a lot of information on the Data Hub. Please feel free to browse it. Remember that the Data Hub is best viewed on a desktop computer. The charts take a long time to load, so please be patient with it as you scroll through some of the charts. So some of the other highlights, that our COVID-like illness does continue to stay with a high burden. So it has had no significant change, so it's staying steady, but we are still seeing a high number of people going to our Sauk County Hospital emergency departments with COVID-like symptoms. So our new cases per day we've talked about. We had 551 new cases in the last 14 days. The number of tests conducted. So even though we take a minute here about this. So even though we are doing less testing in the past 14 days than we had seen in much of November, we are still doing a high level of testing for our community, and our community partners do a great job with our testing sites. So please, when you get tested, say thank you to them for all of their efforts. So we are doing a high level of testing, and this metric has consistently stayed in the green for us. But as we can see with our community spread and with our percent positivity, we may not be testing all of the people that are positive. So there is room for us to do some more testing to more fully contain this virus. The timeliness of lab reporting, we've been reporting on this for a while. That is a struggle. So with the holidays, some of the labs got delayed. In the last 14 days, only 48% of the positive lab results were received by public health within 48 hours of that test being collected. So it is taking longer, sometimes 4 to even 7 days to get those lab results back. There is just a lot of demand on testing. Our timeliness of disease investigation. So this is the amount of time that it takes from the time that public health receives the positive result to when we're able to contact and interview that individual to ensure that they're isolating and to begin, educate them, and so that they can begin to contact their contacts so that they can quarantine. So in the most recent 14 days, 68% of those new cases were interviewed by public health. So that is an increase from previous. So with that decrease in cases, we are able to do more of that. If you remember, back in late October, we no longer had the capacity to complete disease investigation interviews for all positive cases. So if you were tested by your healthcare provider will be the one contacting you with your test results. And if you were tested at a community test site, then Sauk County Public Health staff will be the one contacting with your test results. But we are really hoping that we can continue to increase the percentage that we're able to interview within a day, get that into the yellow hopefully next week, so that people can more quickly be isolated and can also contact the people that they were in close contact with to quarantine and further slow the spread of this virus. And I think that is all that I have to report on today. If you have any questions about any of the information on the Data Hub, please feel free to send an email to covid19@saukcountywi.gov, and I'll be happy to answer your questions. Thank you, and stay healthy, everyone.